Now, one other area before we close up shop here is brain stimulation and psychosurgery. Psychosurgery is not as used anymore since it is dropped off the. Let me write this out first. It is really dropped off. I say I'm going to write it and not talk, and I keep talking. Brain stimulation and psychosurgery. In psychosurgery, a good example of psychosurgery was frontal lobotomies. And I'll hit this first one first while we're on the topic. And for a long time, when patients were out of hand or belligerent or couldn't be controlled in the typical ways of using it, one of the procedures that was done was a cerebral lobotomy, or a frontal lobotomy might be another word that you might hear. And essentially, what it means is frontal is that a surgery is performed that removes or destroys brain tissue in order to change behavior. For example, this lobotomy was used to calm uncontrollably violent or emotional patients. And essentially, the nerves that connect the frontal lobes to the emotional controlling centers of the inner brain are cut. And this lobotomy usually would leave people passive. They oftentimes would have difficulty making decisions because how many times when you make a decision is your emotions involved. And so this, with the development of medications that we just finished talking about, this particular procedure was abandoned, and it's not used anymore today. Now, in very extreme cases, surgeons may deactivate certain specific nerve clusters that cause or transmit convulsions. If you remember, there was the severing of the corpus callosum in a patient who had severe seizure activity in his brain, and one way to stop it was to sever the corpus callosum. So he kind of literally had a split brain, and that would be another good example of psychosurgery in a sense. The other thing that is still being used today is electroconvulsive therapy. You might think that that is long gone therapy. It's referred to as ECT. In extreme cases of depression, ECT is used where a brief electrical current is sent through the brain of an anesthetized patient, and it is oftentimes useful. The side effect with this is memory loss, as you can imagine. I had one older patient who had a very chronic level of depression, older guy, and it went through ECT. It lifted his depression so that he could actually function for a while, but he did experience the memory loss. You have the disorientation, and it is not certainly used at the same rate that it was used in the past. Another one, which I'll add at the end of this particular video, is something that we refer to as RTMS, and it has gotten more and more publicity, if you will. Let me write it out. Repetitive, transcranial, and there's a picture of it in your book. Transcranial magnetic stimulation. And as the name suggests, a very strong magnet is held over the brain surface, and it penetrates to the brain surface It produces no seizure or memory loss or anything of the sort, but some recent studies have confirmed the fact that it has some very positive therapeutic effects. Now, and one of the ones that one of the people that you may know of as Liesel from The Sound of Music, the actress had extensive depression issues, and essentially went through this TMS procedure and raves about its benefit to her. I forget what her actual name is, but you know her as the oldest daughter in The Sound of Music. The last procedure that we can mention is also deep brain stimulation. And in certain cases, with Parkinson's patients and others, patients, and again, I'll make a video available to you to see how this actually works, but it has had tremendous promise in calming areas of the brain that are active in people who are depressed or sad. And the Parkinson's patient, actually an electrode, very similar to the ones that I described, being on the surface of my scalp to control pain, is inserted deep into the brain tissue, and it stimulates that particular area, and people report very positive results in regards to that. So those are some 4 ones. Frontal lobotomy is psychosurgery. ECT is another procedure that falls into brain stimulation. TMS and deep brain stimulation are the other 2 to keep in mind. Like I said, this is a picture just from your brain, but this is how the setup of ECT is set up. One of the things, if you're familiar with A Beautiful Mind, you also see that John Nash went through what looked like ECT, except that instead of electrical current, he was given high doses of glucose. It was glucose convulsive treatment, and that basically triggers a seizure. The expectation was that a seizure was a little bit of a way to reboot one's brain, thinking of the brain as a computer, and that's what you see pictured in there. It is not ECT, and this procedure that you see here is, is literally looks a little bit like a surgical procedure because of how much is monitored, and the patient is monitored through it all. So all part of the backdrop of psychosurgery and brain stimulation.
Electroconvulsive therapy, or ECT, is a powerful way to treat severe depression, but it is used only when traditional medication approaches have failed.
Just look at me.
What about you that's different?
Everything. I smell.
You have a body odor?
Mm-hmm. My hair's falling out.
Hmm?
I'm disgusting. I'm evil.
In fact, you think that you should be dead. Did you try to kill yourself? Did you really?
Yep.
Tell me about it.
Took a bunch of pills, aspirin,
When was this?
on Thanksgiving.
When Mary attempted suicide,
Morning, afternoon.
it opened all her feelings to the world. They now were expressed in all their intensity. She was worthless, hopeless, life was not worth living. She felt she was the devil, and she had the idea that the only way to end this terrible pain was suicide. She tried at home. Her husband brought her right to the hospital, and from that moment on, she had to be monitored We had to have an individual sit with her 24 hours a day because all she could think of was trying to kill herself. There were hours in the next few days that we had to put Mary into restraints. The alternative was that she would scream and try to kill herself by any device possible. It became necessary to treat her as rapidly and as effectively as we knew how for this drive to suicide and this very severe feeling of unhappiness.
I'm going to clean your head off with water.
At the beginning of ECT treatment, the patient is put to sleep, and 30 seconds later is given a dose of muscle relaxant.
Brevitol's going in. Nice deep breath.
You'll be fine by the end.
The lid reflex is gone.
Cuff is up.
Okay. The bite block is in.
Chin up.
The impedance is low. Okay.
At that point, electric current is passed through the brain for a duration of half a second to 4 seconds. Typically, 6 to 10 treatments, spaced over 2 to 3 weeks, will be given. ECT produces a seizure, which needs to last for 25 to 120 seconds to be a good or effective treatment. After ECT treatments, patients will show confusion and loss of memory for recent experiences. Both of these problems clear up, and permanent memory problems after ECT are rare.
Mary, open your eyes. Treatment's all over with.
In Mary's case, medication did not help, and so electroconvulsive therapy was the best alternative. After treatment, Mary discussed her recent depression with her doctor.
The depression that I came in here with, I don't really remember much about.
Remember nothing about it?
Mm-mm. I do remember going home being in the hospital here and going home on Thanksgiving and taking a lot of aspirin. I remember that.
What happened on Thanksgiving?
I remember thinking I was the devil.
Yeah.
And taking aspirin, and then my son coming from my neighbor's house and coming into the bedroom, and then I remember feeling bad that I had done that because I didn't want to die and leave him. And then I told him to go tell his father that I had taken a bottle of aspirin. And then
Electroconvulsive therapy has a very important place in the treatment of certain depressions. It's not a panacea. It doesn't help everybody. But it remains a very effective way for quickly reversing severe depression.